the average number of dissolvable stitches that you put into somebody like me that has a breast reduction?
Well, you will be surprised and disappointed to learn it's probably single figures.
Really?
Yeah.
I thought it'd be hundreds.
Yeah, you would. And I put hundreds of throws, but I no longer cut and tie each one of those anymore. So we go to a lot of conferences, we hear a lot of people, and I had the benefit of hearing a retiring French surgeon who I'd never met before. I instantly had a bit of a man crush on. I thought he was brilliant. I admired him so much. And every word he said was just infused with wisdom. And one of them, and I've stolen so many of his idioms since then, one of them is that there are good complications and bad complications. And there are so if you've got to have one, do things that urge you towards the good one, not the bad one. So too much skin left over is fine. Local anaesthetic, we can sort that out. Too little skin left over is a disaster. Your wound falls apart. It's, you need a skin graft, whatever, etc. Anyway, the stitching. One of the things he flagged up, and I think you have to be in your mid-70s and retiring to have the courage to show your very worst complications, as he did. And one of the things he showed up was one of his scars, and it was awful. It was dreadful. And it had all these cross hatches all the way along it. And he said, if I saw this scar in another surgeon, I would think that surgeon was incompetent. But I did it. And I don't think I'm incompetent. And I would think that other surgeon had used external stitches, and lots of them. But I don't use external stitches. I bury all my stitches under the surface. External stitches, by the way, can really give you terrible scars. I buried mine, and I was thinking, and I was just watching this and thinking, I have a patient in whom that has happened, and I also would have thought someone else would use external stitches, and I know I didn't, and I know I normally get good scars, and what the hell's going on? And this guy was saying, right, here's what's going on. I'm what's going on? The knots, the buried knots under each stitch is rubbing on the undersurface of the skin, and someone who's prone to poor healing, that is enough to stimulate poor healing from the inside, from internally, and you can see it through. And so I stopped doing that. I don't stitch each of my deep stitches anymore. I don't tie a knot. When you tie a knot, by the way, 80% of the suture material is the knot. Not much of it is the loop. The useful bit is the loop for us. That's what's holding things together, but most of it is wasted as a knot. So he says, I just knot it at one end, and I do a deep spiral continuous suture. And there's a little bit of a quite short learning curve to this, actually. It's not quite the same way that we close wounds normally, but once you get the hang of it, it's really good. And that problem has evaporated. It's gone. My wound closures are quicker and better. I have more throws, more deep throws than I used to, more deep supports, less suture material. So actually, to answer your question, as I finally get around to, I'm using lots and lots and lots of throws, but I'm only using one stitch for the whole thing, deep. And then superficial, I'll do a subcuticular, which is the very most superficial one, with a finer stitch, again, one stitch, continuous. So I might use, I said single figures, maybe I'm using 6 or 7 per breast. But it's low numbers. But how many throws? I mean, hundreds and hundreds, I don't know. So if it's stitches in the traditional sense, like you go to A&E and you get stitches and your friends in the playground said, how many stitches you get? So I had 20 stitches. I mean, you would have had many hundreds of stitches. But really the number of sutures we've used is small numbers.
Amazing.
Yeah.